action.
Hey. Hi, my name's Cindy Barshop. We're here at the V-Spot with a renowned women's sexual health expert, Dr. Carolyn DeLucia.
Thank you, Cindy.
So today we are going to talk about the big V, vagina. And I'm going to answer all your questions. What happens down there? What are the changes? Why does sex... Nah. Should I keep going?
Yeah. Yes.
Why after I give birth am I loose and sex doesn't feel the same? Why is it dry down there? Why is it loose? Why is it too tight and it hurts when I have sex now? There's an answer to all these different changes that happen to the body, and we're here to give you solutions to all these different changes. They're simple, there's no pain, there's no downtime. So, we're going to go through it simply. The first and the biggest one is the vaginal looseness that I hear from all the clients after you've given birth. And the doctor says, oh, it snaps right back. Well, I didn't snap back for me. Can you please explain a little bit about that?
Certainly, certainly. The bottom line is that when we have a child, our tissues do get stretched. And the way I look at the vagina is like a rubber band that gets a little bit overstretched after having a child. And it doesn't quite bounce back to a brand new rubber band. It remains a little bit looser than it had been before. In some women, not everybody, but in the majority of women, there will be some laxity following childbirth. So it may cause a decreased sensation of friction with intercourse and change that intimate feeling.
Okay, so why do I hear so many times the client comes in and they'll say, I can't have sex anymore, it hurts. What are some of the reasons for that?
The reason when it gets really painful for the most part is once we go through atrophy or menopausal change. And once we lose our hormones, the vagina gets dry. And by getting dry, we're not releasing any of our natural secretions. The walls thin. Normally we have folds in our vagina. Those disappear and it becomes like a smooth ice skating rink. We lose blood supply to the area and it becomes less pink. It's a pale pink. That's a sign of less blood flow to the area and less lubrication. So with the loss of elasticity that occurs because of the walls thinning and the loss of the blood vessels and the cells changing, we get less lubrication. It feels like sandpaper.
One other big one is the incontinence. I laughed so hard I peed in my pants. So I work out and there's a little bit urinary leakage. That was me.
Yes.
Anyway,
yes.
Why does that happen?
That happens most often. It's from childbearing. And I say childbearing to specify that it doesn't matter if you have a cesarean section or a vaginal birth. It can be worse with a vaginal birth, but even patients who have had cesarean sections will experience some urinary weakness. And what happens is the actual bladder neck changes its location in the vagina from carrying the weight of a pregnancy. So with that, we have changes in our ability to hold the urine in.
But there's a solution to all this, and it's quick, it's painless. I know I sound like a magician, but it's basically, we're magicians at the V-Spot. No, there's something called the Femilift. It's incredible. It actually treats all these different issues, whether it be vaginal dryness, looseness, need more lubrication, incontinence. It's 3 sessions, spread out once every 3 weeks. There's no pain in between, there's no downtime in between. It's just results. And Carolyn, you want to tell us some of the results that you found?
Absolutely. The beauty of the laser, as we've discovered, it's a CO2 laser, which is a type of laser that used to be used to treat the face and completely resurface the skin. What we found is by modifying it a little bit, carbon dioxide can be used to form tiny little micro injuries in the walls of the vagina, and the body's response to that is to jump right in and heal those tiny little injuries with new blood vessels and new collagen and new elastin. And what that does is it brings back that rubber band to a brand new rubber band so it can snap on back, and it also can stretch, so it allows the atrophy to bring back its elasticity and accommodate what may be penetrating. Also, with the looseness, it's going to give a sense of being tighter by causing that elasticity and cling. So it increases friction and it increases our sensation and lubrication and support to the bladder neck, which is what has weakened with age and childbearing. Therefore, we get improvement in some of our incontinence symptoms.
There you have it.
Yeah.
If you like, come to the V-Spot, come in for a complimentary consultation. We can talk about your specific issues and have a consultation and talk about some of the results that we have available for you.
Wonderful.